Okay, peace be to you all. This is Omar Abdul Malik, physician associate / assistant and health educator. So it is September 7th, 2021 as of the shooting of this video. I want to wish you guys a happy Labor Day. So as we know, Labor Day is, I think it's a unique American holiday. It was started in 1898, I think, under the Cleveland presidential administration, and we've been celebrating it ever since. So it's just to acknowledge those of us Americans who are laboring or working. If you're fortunate, especially in this day and age during this COVID-19 pandemic, to have a job, it's truly a blessing. So I am a physician assistant / associate. I say assistant, I graduated from PA school back in 2000. So this is my 21st year as a physician. I've been saying physician assistant for the past, 23 years since I got into PA school back in 97. So it's still a challenge for me to switch over to physician associate, even though I think according to the AAPA, that's now the official term for us. But I think the media still uses physician assistant in many ways. I've been doing this so long, it's like potato, patata, or tomato, tomato for me. Maybe there's different implications and connotations to the word. But it hasn't really changed the function of what I do. I did outpatient for 15 years, and I've been doing hospitalist PA for the past 6 since 2015. But it's a great job. So I think talking about Labor Day is a great segue into talking about the PA profession. If you're interested in it, it is the #1 profession in the U.S. according to U.S. News and World Report as of 2021. The average amount of time that it takes to become a PA, it says 26 months, but it's actually 6 years if you take into consideration that you have to have a 4-year degree to even be eligible to apply for PA school. So the PA school is actually 26 months. It's a graduate degree. And in some cases, you have to either take the graduate record exam, which is the GRE, or the PCAT. So it's a new entrance exam for a PA school. And then varying degrees of direct patient contact hours. I've talked about that in some videos. So whether you're going to be a nurse, a nursing assistant, phlebotomist, or EMT, the choice is really yours. And then get 3 good letters of recommendations, preferably from PAs. Then do your personal statement based on why you want to be a PA, and interview well. I've got some what I think to be good interviews, good videos about that. I was on the admissions committee many years ago, and Lord willing, you get in, finish, pass your PANTS, your physician assistant national certification exam, and then get hired and get your license. And, go on to a very rewarding career. I've really enjoyed being a PA, and it's not for everybody, but that's the beauty about the allied health field, is that there's so many different jobs that you can do. So many things in which you can labor within the healthcare paradigm. And I've been doing that for 30 years. I started out as a certified nursing assistant back in 1990, and that was very valuable. So more about PAs. I think there are about 150 licensed PAs in the U.S. There are about 254 PA schools. I've done some videos about how to get into PA school and what to look for. But it's very rewarding. I've really enjoyed it. It has its pros and cons. I've done videos about that, but it's yeah, I think you'll really enjoy it if you want to be a service to your community, a good example for your family and your the youth around you, in particular your children, and provide for yourself. The average income for PAs is about $112,000 a year. You can easily make up as much as $200,000 as a PA, especially if you work in higher tier specialties like hospitalist medicine, ER, aesthetics medicine, surgery, and then certainly there's always moonlighting also. Some of the skills that you'll have to have is be able to think fairly quickly on your feet, be flexible, and also be a voracious consumer of information. So I try to discipline myself to read every day, read something medically inclined every day, especially now with the COVID-19 virus pandemic. There's a lot of information out there. Some of it is with varying degrees of accuracy. So you have to be a very astute consumer of information and be able to discern between the two. You've got to have good leadership skills. I've served in leadership capacity in the PA field. I've been a college professor at PA's programs. I've been on committees to choose chair of programs. I've been a delegate for the AAPA, the American Academy of Physician Assistants. I've been the president of the DC AAPA, which is the DC Academy of Physician Assistants, and other things. Now, I interviewed for a chair position several years ago. So even though you're an assistant or an associate, there's still plenty of opportunities for leadership within the healthcare field as a PA. So really it's up to how motivated you want to be. And you also can further educate yourself. I got a doctorate of health education, and that really comes in handy now with educating people about this COVID-19 pandemic and dealing with the mask and the vaccines and so forth. I'll do another video about that in the future, Lord willing, inshallah. But that's it for now. I'm tired. I'm still in my work outfit. I just got off night shift. But I wish you guys the best of success in your positive endeavors. If you have any interest in becoming a PA or know somebody who's interested in becoming a PA, feel free to reach out to me in the comments section. I'll put some contact information in the description. Also check out some of the other videos by some of my colleagues in the PA field. I just do a vlog, but some of these PAs, the younger PAs in particular, have done some really good YouTube channels where they edit their videos and have some really good information there on their channels. But that's up for now. Wish you guys the best. Take care. Peace.